Hi, everyone. The topic I'm going to be presenting on today is physical therapy for chronic pain management and opioid use reduction among people living with HIV. So a quick background on this. The HIV Medical Association has estimated that people living with HIV, a prevalence of about 39 to 85%, experience chronic pain, with the average of the general population in the country being around 11% of adults currently experience chronic pain. We can see how this population displays a lot more chronic pain than typical. And the standard care for mitigating chronic pain has historically just been prescribing opioid analgesics to control it. But the CDC has come out and said that prescribing opioids to control chronic pain, there's really no evidence to support the long-term use of it. And as we're aware of, there are a number of negative side effects associated with long-term opioid use. So the question is, how can physical therapy help this? So in multiple studies, there have been PT interventions that have been proven effective for reducing the chronic pain in this population. Some of those that we're aware of include home exercise programs, manual therapy, therapeutic exercise and patient education, soft tissue massage, topical pain relievers, taping, and one of the most effective treatments has actually been high-frequency TENS. High-frequency TENS has been found to be just as effective as an opioid alternative for controlling the pain. And the reason this is because the high-frequency TENS actually stimulates the same receptors that opioids bind to. So fun fact there. In all populations, and especially in this population, it's important that we're providing client-centered care. So whenever we think of a patient with HIV, there is a number of contextual factors that they're also facing that we need to be aware of to make sure that we're providing the best care possible for them. Some of these include aging, social isolation, the nature of the HIV virus and other effects it may have, the comorbidities they may have. We've seen this in many of our patients in physio as well. So kind of just knowing how to work with comorbidities, the continuation, and in this population especially, the consistency of care so that we're controlling that chronic pain with physical therapy treatments and not with opioids. A massive one for this group is the stigma that's related to HIV/AIDS. This is a stigma that everybody is aware of, that they're also aware that they live with. So just being cognizant of that will help us provide better care for this population, and also resource security. One of my favorite things that I found when looking into the literature on this topic was a case report on a 64-year-old man diagnosed with AIDS who is currently using, before the study, 15 milligrams of hydrocodone to control his pain. The intervention in this case was a 24-session physical therapy intervention, just aiming to decrease the chronic pain while simultaneously weaning off opioid medications. Some of the interventions that they used, almost all of these we're familiar with. Electrical stimulation, TENS, as I mentioned earlier, a home stretching regimen, and they also were teaching him diaphragmatic breathing techniques to help control the pain as well. So how did this work out? So following the 24-session intervention, the patient's self-reported pain went from a 10 out of 10 to a 0 out of 10, which is as significant as it gets. The patient was having independent pain management and was also having increased independence when doing functional activities. And the most important aspect from this study is that throughout the use of physical therapy, he decreased the use of opioids from 15 milligrams of hydrocodone to 2.5 milligrams. So an 83% decrease. This just shows how effective physical therapy can be in controlling chronic pain. And as we've discussed in our clinical education and many of our other classes, a lot of the population is not educated on how beneficial physical therapy can be for managing chronic pain, and especially for just weaning off of long-term medications that have negative side effects, such as opioids. So I was very happy to kind of look at this population in particular, since I knew it was one where chronic pain was a major symptom that they live with. And it was great to find out how effective physical therapy can be. So I hope you guys enjoyed it.